How do you look at an aesthetic situation and determine what's wrong? Where should the teeth be? If they've got short teeth, is it an incisal edge discrepancy or a gingival discrepancy? Let's first talk about the incisal plane. The central incisors, when viewing the patient from the front smiling, face to face, the central incisors should always be the longest teeth. There should be some tooth display of central incisors with the lips in repose. When you lick your lips and let the lips hang, there should be some tooth display. When you draw a line from the tip of the cuspid to the tip of the other cuspid, this incisal plane should form a U and be approximately parallel to the lower lip. A line drawn across the incisal plane of the central incisors should be parallel to the pupillary line, which is parallel to the bench stop, which is parallel to the floor. Midline is of little consequence. If the midline is off one way or the other up to 4 millimeters, people don't notice that. And so I see sometimes that people are having orthodontic treatment to align the upper and lower midlines. Don't do that. Don't do that. It doesn't make any difference. I don't know if mine are aligned. It's of no consequence. Now, you do want the midlines to be perpendicular to the pupillary line. Even if they're off to the right or the left, you want the line not to slant like this. You want it to be perpendicular to the pupillary line. So you can see this is a good line here. This is barely a good line here. I wouldn't mind those centrals being a little bit longer. Sometimes you'll see that are convex coronally. I don't think that's a good look. I really don't. I'd rather see a straight line across the lower incisors with the cuspids being a little bit longer than the incisor teeth when viewed from the front. And then the occlusal plane should blend seamlessly with the incisal plane. It should form a U, not a step. Now this is a reverse curve. We don't want this. Not only can it cause a lift, it makes the patient appear that they're frowning. These are the lengths and widths of the teeth. The average central incisor is about 11 millimeters long from CEJ to incisal edge. The average cuspid is also about 11 millimeters from CEJ to incisal edge. The average lateral incisor is about 9 to 10 millimeters incisal edge to CEJ. Width, the average central is about 9 millimeters. The average lateral incisor is about 6.7 to 7 millimeters, and the average cuspid from mesial to distal is about 7.5 millimeters. The average lower incisor is about 9 to 10 millimeters in length, usually about 9. I go with 9. Width-wise, upper incisor is about 1.5 times the width of a lower incisor. So put all the information I'm about to give you into your mental computer, so when you see someone with an incisal plane that's off, you know how to correct it. The interproximal contacts between the central incisors are near the incisal edge. As you go back toward the bicuspids, the interproximal contact moves apically. A little lower between the central and the lateral, a little lower between the lateral and the cuspid, and a little lower still apically between the cuspid and the bicuspid. The height of gingival contour of the central incisors is about in the center of the tooth mesial-distally. As you go distal, it moves back just a little bit. The gingival line. This is so important in cosmetic dentistry. Many times dentists restore teeth and they don't think about the gingival line. How does this all fit together? The gingival line and the incisal plane of the maxillary anterior teeth and the mandibular incisors should be parallel with the pupillary line. Now remember, the pupillary line represents the earth or the floor or the tabletop. It's a flat plane. The gingival line should parallel the incisal plane. If you've got one tooth in which the gingival line is coronal to the ideal gingival line, it looks weird. So how does the gingival line go? The line is pretty straight between, if you drew a line from cuspid to central incisor, it's pretty straight. The gingival line drops a little bit coronally when you pass the lateral incisor. So it's a little more coronal over the lateral incisor than it is the central and the cuspid. You've got different arrangements of teeth depending on what the objective is, but you'll notice this incisal plane always parallels the lower lip. It makes a U like the lower lip. What about the shape of the teeth? These are the centrals. You've got transverse ridges here. You've got a concavity in the middle of the tooth. The V's, see, this is narrow and inverted and not very deep. This is a little asymmetrical and a little bit flatter. And then the V between the lateral incisors and the cuspids is quite dramatic. Now you'll notice that edges of the centrals are rounded on the distal part and less rounded on the mesial part. Same with the lateral incisors, much more rounded on the distal and less rounded on the mesial. And the cuspids pretty straight into this V on the mesial. Lighter teeth will appear larger and closer to you. Don't forget, if you tell the patient something ahead of time, it's a reason. If you tell them after there's a problem, it's an excuse, and they're not going to believe you. Those teeth are going to feel larger and closer to the person they're speaking with. So when the patient looks in the mirror, they may very well think they've got larger teeth. So talk about this preoperatively. Some important aesthetic concepts. Don't forget these things. The maxillary central incisors should be longer than the laterals and the cuspid when viewed from the front. Even though the cuspids and the centrals are really about the same length, the gingival line and the incisal plane curves apically as you go from central to cuspid. So it appears that the centrals are the longest teeth when viewed from the front. And this incisal plane parallels the lower lip, and the incisal plane of the central incisors parallels the pupillary line. This is good, 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 bad. See how that looks funky? Weird, strange, because it's a reverse curve. So you would want to lengthen those teeth enough that the centrals are the longest teeth. Now, how much do you lengthen them? Enough. If the patient is going from a reverse curve to the proper length, you don't want to make the teeth that long. Just lengthen them enough so that they are the longest teeth. There should be tooth display with lips in repose. There are three types of lip: the flat lip in repose, the moderately arched lip in repose, and the maximally arched lip in repose. The flat lip is like my lip. And when I lick my lips and let my lip hang like that, there should be some tooth display when the lips are in repose. You always want tooth display when the lip is hanging. That's a flat lip. A moderately arched lip, you see a quarter to a half of the tooth when the lip is in repose. And then a maximally arched lip, you see the entire tooth when the lips are in repose. So the only time you can use the lip as a guide in maxillary incisor tooth length determination is when there's a flat lip. You can't use the lip when it's moderately arched or maximally arched. See, Kate Moss has got a moderately arched lip. This is when she's in repose, you see about half the tooth. Many models have moderately arched lips. See, she's just letting her lip hang and you see about half the tooth. This guy's got a pretty flat lip. Most men do, so you see some tooth. Beyonce, got a moderately arched lip, you see about half the tooth. It's not fair, because if you've got a moderately or maximally arched lip, when you smile, you just have to kind of tweak the corners of your mouth and you've got this wonderful smile. People like me who have a flat lip have to move the lip more, maybe 7 millimeters for smiling. So the ideal smile displays the free gingival margins of the centrals along with 9.5 to 11 millimeters of central incisor tooth structure. Some people display very little gingiva when they smile. Others display a little bit more. As we go through these cases, I'm going to show you that gingival display is not a problem, as long as the teeth are the correct length. Now, something that is a bit of an issue is when you have little bitty teeth, say 8 millimeters, 7, 8 millimeter central incisors, and lots of gingival display. That's a very juvenile look. As long as the centrals are about 11 millimeters long from CEJ to incisal edge, the centrals are the longest teeth in the incisal plane. The maxillary incisal plane forms a U and parallels the lower lip and is parallel to the pupillary line. Then gingival display is not an issue. It's just when the teeth are real small. Now, how do you correct a excessive gingival display condition if the centrals are already 11 millimeters long? I don't like centrals in a normal situation to be longer than 12 millimeters. That's max for me, unless the person was just a giant. Well, if you still have a lot of gingival display and the patient wanted to correct that, the only way they can do that is with orthognathic surgery. As we said, the average central incisor is 11 millimeters in length from CEJ to incisal edge and about 8.5 to 9 millimeters wide. So these are just about perfect. And you can see again, the incisal plane parallel to the lower lip, and if you drew a line from the centrals back to the occlusal plane, it's smooth. It's like a U. It doesn't go like this and then back. It forms a U. The average lip moves 3 to 7.5 millimeters from repose to full smile, depending on the lip position when the lips are in repose. A flat lip in repose will move about 7.5 millimeters from here to full smile. So when she smiles, if you measure from the lip position on the tooth in repose to the lip position on the gingival tissue in full smile, the lip is only moving about 3 millimeters. Whereas if you look at a patient with a flat lip, that lip may move up 7 millimeters. The gingival border of the anterior and posterior teeth should be symmetrical and parallel the incisal and occlusal planes. What that means is the gingival line going all the way around the arch should parallel the incisal plane and the occlusal plane. The maxillary incisal plane should parallel the lower lip, gingival line, and pupillary line. I'm going to pound this in so you don't forget it. And the occlusal plane should extend from the incisal plane, forming a U-shaped arch. And that's the dental minute.